It's just that the good and accurate information now has a federal platform. Hey guys, I'm Katla. Welcome to my second episode. Today I'm going to be discussing double masking and why you should do it if you haven't already. So I guess I'm just going to be adding to the constant discourse about, masking we've had for a year now, and a discussion on why double masking is a good idea. As a disclaimer, I am not a medical doctor nor a public health expert. I am a science communicator that focuses on public health. The topic of double masking came into the public psyche, specifically in the United States, about a month ago now, when Anthony Fauci mentioned it in a press conference, and the CDC started releasing new guidelines and the studies backing it up. After this was mentioned, there was so much media coverage about the concept of double masking, but I never really see the actual science and reasoning behind this recommendation centered in these discussions. Honestly, all this drama of just like double masking rather than single masking just, I don't know, makes me laugh, sigh, facepalm, lose faith in humanity. Yeah. Personally, for me, double masking has been a normal thing since I started a new job back in July 2020 that couldn't be done from home. The concept of double masking and the reasoning behind it is not new information. It's just that the good and accurate information now has a federal platform. When it comes to mask, proper fit is the most important part. There should be no gaps around your mask because, that means air will get in and out without being filtered. The mask should reach from the bridge of your nose to just under your chin and to about halfway across your cheeks. The mask should be tight enough against your skin so that there are no gaps and it stays in place, but not so tight that it hurts to wear and you want to fidget with it. With the recommendation of double masking, what we are focusing on is reducing the gaps around masks that people are currently wearing. When you layer a cloth mask over a surgical mask, the surgical mask will fill in any gaps that come from the cloth mask. This is especially important because many of us have mass-produced cloth masks that weren't made specifically for our faces. Sometimes homemade face masks will be better measured to faces or personalized in different ways, but that is not common. And in turn, the cloth mask will help keep a surgical mask better in place and reduce the chance of it slipping and leaving gaps. For those who go, if 2 masks are better than 1, why not 3, 4, 5, 500 million masks? When will this madness stop? I mean, the madness will stop if you wore a mask in the first place. But anyway, the madness stops when the multiple layers of masks are truly too hot or uncomfortable or difficult to breathe through. Additionally, when it gets more difficult to breathe through, you're going to be breathing heavier, and there's more chance that the force of your breath will cause gaps in the masks again, which is exactly what we're trying to prevent. With the rise in variants that are showing to be more infectious, along with the potential for a vaccine variant to come out of all of this, double masking and just protecting yourself in any way possible is just more important than ever. As long as we have such a high case rate in the United States, which we still do, we have not ever truly recovered from the first wave a year ago. There will always be a chance of more variants happening. So to protect yourself, for most people, double masking with a cloth layer and a surgical layer will be fine. As I said earlier, layering the cloth mask and surgical mask will fill in any potential gaps, ensure a better fit, but it will also give you benefits from mixing materials. Many times during the pandemic, we've talked about the Swiss cheese model of risk prevention. This is where the next layer covers the failures of the previous layer. So in this case, with the multiple layers of masks, this is a much more literal visualization of this kind of model. And with this, if you have sensitive skin and you can't wear a surgical mask because you'll get like either maskne or contact dermatitis or any of those issues, layering the surgical on top of the cloth will still give you some benefit. So in general, cloth masks and surgical masks protect you in different ways in addition to both being barriers. And 100% cotton mask in a tight weave, specifically if it's dual or triple layered fabric, will provide a purely physical barrier. On the other hand, surgical masks are made of polypropylene, which is a charged material that uses electrostatic filtration. On the molecular level, a charged material can just grab viral particles. Personally, earlier on in the pandemic, before this official information came out from the CDC, I would regularly be layering the surgical mask over the cloth mask, mainly because I wanted to use the cloth mask to protect others from myself by keeping in my respiratory droplets with a well-fit multi-layer cotton. And then on the other hand, the surgical mask on the outside would be protecting me from aerosolized particles, which are smaller but also more sensitive to the electrostatics of a charged surgical mask. However, in any case, if you want more protection than the double layer of masks, whether you are working with a vulnerable population, you're most likely to have exposure with COVID, you have a condition yourself that would make exposure to COVID and infection really, really bad, I recommend you use a KN95 or KF94 mask. In the United States, unless you're a healthcare worker or, well, even if you're a healthcare worker, there's very little chance you have access to a true N95 mask, but you will be able to buy KF94 or KN95. These are the Korean and Chinese variations of the N95, respectively. KN95 and KF94 masks are suitable replacements for N95s. However, there is an issue with counterfeits online frequently, so you have to do your research and make sure what you're buying is the real thing. In my first episode, I also discuss a bit about KN95 and KF94 masks, so I'll be including the link down in the description. So between KN95 and KF94 masks, as someone with a wider face, I prefer the KF94 mask as something that fits better, while KN95 masks seem to be designed more for people with longer oval faces, so that's just something to keep in mind when you're considering shopping for these masks. So currently for myself, especially since I work with vulnerable populations, I will wear a KF94 with a fabric mask layered over it. Currently, especially since I work with vulnerable populations, I will wear a KF94 mask with a cloth mask layered over it. I do this because arguably the cloth mask will extend the life of the KF94, and I'm not saying I'm going to be re-wearing the KF94 on multiple days. It's just that in my job, I occasionally have periods of 5 or 6 hours where I don't have any break to change out my mask or do anything different, and I can be in contact with a lot of people. So it's important to me to have that bit of extra layer of protection. Also, my cloth masks are cute, and I think I have like 100 of them at this point. It's a problem. Down in the description will be the link to my first episode where I talk about why you will be needing masks even when there is no longer a pandemic. And also I am including a link to a Google Drive folder where I'll be having reference lists and episode outlines posted to increase the accessibility if you want to do more research. And with that, thanks for watching. Please like, subscribe, leave a comment below, especially if you have a topic you'd like me to cover in the future. And well, stay safe, wear a mask or two, and I'll see you later. If you want to like people, don't study public health. It makes you sad.